Hi everyone, welcome back to my YouTube channel, and today we are going to talk about oral pathology. So let's start our topic with introduction. Oral pathology is branch of dentistry and pathology that deals with study, diagnosis and management of diseases affecting the oral cavity, jaws and related structures. It bridges clinical dentistry with laboratory sciences. Scope: it covers a wide range of conditions including developmental anomalies, infections, tumors, cysts, and systemic diseases that manifest in oral cavity. Oral pathology play a vital role in early detection of oral cancer and precancerous lesions. Importance of oral pathology in dentistry. Understanding oral pathology helps dentists recognize abnormal changes in the mouth and differentiate between benign and malignant conditions, and also to provide appropriate treatment or referral. Normal oral structures. Knowledge of normal anatomy and histology of oral tissue is essential. These include teeth, gingiva, tongue, salivary glands, and mucosa, which serve as a baseline for identifying pathological changes. Developmental disorders. Oral pathology studies congenital and developmental anomalies such as cleft lip and palate, anodontia, supernumerary teeth, and enamel or dentine defects. Inflammatory and infectious diseases. Conditions like gingivitis, periodontitis, candidiasis, heart simplex infection, and bacterial abscess are common areas of study in oral pathology. These diseases often present with pain, swelling, or ulceration. Cysts of oral cavity. Odontogenic and non-odontogenic cysts are frequently encountered. Examples include radicular cysts, dentigerous cysts, and nasopalatine duct cysts. Their identification is crucial for surgical management. Tumors of oral cavity. Oral pathology deals with bony benign and malignant tumor. Benign examples include fibromas and papillomas, while malignant ones include squamous cell carcinoma, salivary gland tumors, and lymphomas. Precancerous lesions and conditions like leukoplakia, erythroplakia, or submucous fibrosis and lichen planus are considered precancerous. Early recognition and management are essential to prevent progression to oral cancer. Systemic diseases with oral manifestation. Many systemic conditions prevent an oral cavity, such as diabetes that present as delayed healing and infection, anemia that present as pale mucosa and glossitis, and HIV or AIDS that present as oral candidiasis and Kaposi sarcoma. Diagnostic method. Oral pathology relies on clinical examination, radiographs, biopsy, histopathology, cytology, and laboratory tests to confirm diagnosis. These methods ensure accurate treatment planning. Role of oral pathologist. An oral pathologist works closely with dentists, surgeons, and medical specialists to provide diagnostic expertise, conduct research, and contribute to patient care through laboratory analysis. Conclusion of this lecture video. Oral pathology is the cornerstone of dental science, enabling early detection and management of oral diseases. Its integration with clinical practice ensure better patient outcome and advances in oral health care. And this was all about oral pathology. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.